Hello, everyone, and welcome to AHP Live from Advocates for Human Potential, where our experts look at issues affecting public health and human services organizations and give you real-world solutions for real-world problems. My name is Kristen King. I'm your host, and I'm the Director of Digital Strategy here at Advocates for Human Potential. And today I'm joined by AHP's Rebecca Starr. I'm going to add Rebecca to the screen. Here we go. Hi, Rebecca.
Hi, Kristen. How you doing?
I'm good. I'm so excited that you're here.
I'm excited to be here.
Everyone, I want to let you know Rebecca is the director of AHP's Massachusetts Access to Recovery Program, or ATR. ATR is a 6-month program that provides recovery support services for individuals who are in early recovery from substance use disorders. As part of Rebecca's management of ATR for the last 11 years, she created the nationally recognized Career Building Initiative, or CBI for short. And ATR's career building services provide a menu of job training programs for people in recovery to help them develop skills that allow them to compete for today's jobs. Rebecca's going to tell us more about ATR and the career building services in particular. And while we're talking, I'm going to be keeping an eye out for your comments and reactions for those of you who are watching this live. If you have any questions for Rebecca, I'm going to ask you to type them in the comments. We're going to address as many as we have time for today. And before I go on, I just want to make sure that I'm seeing everyone. I've got some comments coming in that you are confirming that you're here. Awesome. Thanks so much. So feel free to use those comments as we go through the conversation today. And you can also give us reaction icons and just, let us know how you're experiencing this. We love to see those pop up. So with that, Rebecca, tell us about access to recovery. Who exactly does the ATR program serve, and how does it work for those who aren't familiar with it?
So I'm thrilled to be able to describe the ATR model in Massachusetts. First of all, just so you know who's eligible to be in the ATR program, people must be dealing with a substance use issue. They have to be 18 years old or above, be ready and motivated to work on the recovery, and be involved with someone who serves as a staff person, professional in the recovery community. And also we work in 5 cities in the state of Massachusetts. They're Boston, Springfield, Holyoke, Worcester, New Bedford, and Lowell. Just to give you a sense, our typical ATR participant, predominantly male between the ages of 25 and 50, and have been involved in some way in the criminal justice system. Either they were released from incarceration recently, or they're on parole or probation, or they're working with a drug court. So our participants are given an ATR coordinator. One of our ATR coordinator works with them on an individual basis and helps them to develop a recovery plan with their own goals and objectives for the 6 months that they're in our program. Our ATR program is a 6-month program. And once they define what their goals are, then they work with the ATR coordinator to help them decide which of our services that we offer will be best able to meet their recovery goals. And the goal is when they get discharged in 6 months, they will be in a far better place than when they began.
That's so exciting. And it's been really fun for me to be able to work with you on ATR here and there the last couple of years to just see how this is developing. And so for the folks who haven't had the kind of behind the scenes look that I've had a little bit of, tell us how ATR started.
Well, ATR started on the federal level from the SAMHSA, Department of Health and Human Services. It was a federal grant program, and at one time there were more than 30 states and territories operating ATR programs in their own locales. And the overall goal of the national model was to address the social determinants of health, those economic and societal challenges that people with addictions face. So ATR was based on the foundation that clinical treatment or medication treatment for substance use alone is not enough by itself for recovery success. It is a chronic medical condition. and there are relapses. That's kind of part of the disease. And there is no way you can expect someone to go into one treatment episode and expect that all will be well after that treatment episode is finished and the person is discharged. So, to reinforce the gains that the person made in treatment and to improve their quality of life more generally, people often benefit from a menu of recovery support services, which also help them reintegrate into the community.
Well, and right, because after discharge, if they're going right back into the situations that contributed to their challenges in the first place and nothing's changing there, like, what are we going to do?
You hit the nail on the head, exactly. If they don't, or we don't, address the obstacles that they will face when they re-enter their communities, if we don't focus on those challenges proactively, they won't have the most optimal chance for success. So we started ATR in Massachusetts by providing services primarily in the area of basic needs. What are these? These are the critical items people need to re-enter the community, such as transportation passes, getting official state IDs, driver's licenses, paying for items not covered by Medicaid, such as some copays, eyeglasses, hearing aids, paying for gym memberships for fitness and health, and some money towards rent or utilities, purchasing cell phones so they can stay connected to either their sponsors or their clinician or their family, and being able to go out and purchase items like a winter coat, shoes, or items needed for work. These are the critical basic needs items that we started providing when we began ATR.
Well, and since then, you've started to provide a ton more services, although obviously these are super important. So tell us a little bit about those and like how the program evolved to include these other areas as well.
So we ran ATR that way for a while, and then we found that we were certainly helping people, and their outcomes were pretty positive
Hmm.
just by being able to get these critical basic needs met. But when they were discharged 6 months after they started, they had items that they needed, but they were not any further along in being self sufficient and being able to support themselves.
Hmm.
So we decided that in addition to meeting their basic needs, we needed to do something to get them to become more stable financially. So we decided that the way to do that was to put a laser focus on employment. Because in order to be able to support yourself and be self sufficient, you need an income. So they need jobs. So we decided to focus on that.
Got it. I mean, that makes perfect sense. And also, we know that so many individuals in recovery have a lot of barriers to employment. And you mentioned this kind of in the opening, but just to draw folks back to this, a lot of the folks that you serve through ATR have had contact with the criminal justice system. They may have experienced incarceration. They might have big gaps in their career history. And it's really hard to get a job with a living wage when you're bringing those obstacles to the table.
Yeah, and that's exactly what we found, Kristen. It was pretty clear from the beginning that what our participants were able to get in terms of jobs were only very low level, entry level jobs with very poor wages and almost no opportunity for career advancement. So we decided to change our focus away
Hmm.
from just providing job search services. And we decided that we needed to put the focus more on upskilling them, upskilling the individuals so that they would be trained for the skills needed in today's job market. And then they would be able to qualify to compete for good jobs. In today's economy, as you know, people need to have specific occupational skills as well as technological skills. And
Hmm.
many of our participants had no experience with computers or technology. And we found that without those skills, they'd never be able to compete for good quality jobs in the marketplace.
Even without those other barriers, the lack of those specialized skills can really hinder folks from finding a job at all, much less one that can become a rewarding career that they can actually live on.
Yeah, yeah. And that's why we decided to make our goal to set people up for long-term career success, not just those entry-level, low-level, low-wage paying jobs.
Mhm.
We know that being employed in the long term has a very positive impact on people's long-term recovery. And so that's where the career building services program that I created came from. What we decided to do was develop an array of job training programs in occupations that we knew would be open to hiring people with criminal backgrounds, because we didn't want to train them in anything where when they graduated, they wouldn't be able to get hired. So that constrained our options a little bit, but we have developed a menu of job training programs such as in culinary, customer service, truck driving, office work, introductory IT jobs, HVAC, and that's only to name a few. And what we did was we paid for their tuition in these training programs in full. They didn't
Mhm.
have to pay a cent. And not only that, one of the hallmarks of our model, which is different than many models, we decided to give them income while they were actually studying and training. So for every hour they attend the training program, we give them $10 an hour.
So not only are you covering the entire cost of the training program, so it doesn't cost them a penny, but you're actually paying them an hourly wage for the time that they're spending in the training.
Exactly.
This is brilliant. I love this. This is one of my favorite things about what you all have created here, because this allows people to actually complete the training program because they're not worried about how they're going to keep the lights on or how they're going to put food in the fridge because they have this basic income to cover their needs. I love this so much. It solves so many problems in the short term so they can really focus on the long term.
That's exactly right. Yeah.
So did it work?
Well, yes. Yes, it sure did, and we've had, almost 7,000 people go through one of our job training programs, our career building services, and not only have they gone through them, but the attendance and the completion rates are astounding for this population. So 93% of the people who enrolled in one of our job training programs said at the end that they felt prepared to find a job in their area of interest at the end of the training. And 87% of the people who enrolled completed the program. An 87% completion rate. That's pretty astounding. And to add to that, when they were discharged 6 months later, people were either employed or had decided to go back to school and continue their education, and it was a four-fold increase from their status at intake.
That is absolutely amazing. And just in the interest of transparency, this is not the first time that I have heard these numbers, but they blow me away every time. Like astounding is exactly the right word.
Yeah, it really is. I have to say that beyond our wildest expectations when we created this program, our participants are doing really, really well.
That's so amazing. And I realize that we have, just a compressed time today, but in like, I don't know, 30 seconds, can you please tell everyone exactly how you did this?
We had to pretty much start from scratch because there were no real models of job training programs that had been customized for individuals with substance use disorders.
Mhm.
So the short answer, very quickly, is that we worked with the workforce system in our state in Massachusetts, and we created, first of all, a 3-week standardized job readiness curriculum specifically for people with substance use disorder. And after they complete that program, we also offer a number of training programs. We reached out to existing job training programs in our cities to refer our participants into. And we also worked with job training programs to customize programs for us. And we also are now partnering with community colleges in our cities to create customized curricula for our participants.
So That's like the short answer. I know we could talk about this all day, but if folks want the long answer, how can they get more information about the amazing work that you've done with the Massachusetts Access to Recovery Program? Because I know that when the people are watching this, the folks who are watching it live, the people who are watching on the replay are going to want to know more about how they can create a program like this in their state. And I also know that you have a special event coming up that might help. So please tell us everything.
Yeah, so we're thrilled. For the very first time, our team, our ATR team, is implementing a one-day virtual symposium. It's going to occur next month in September, September 14th to be exact. The symposium is virtual, so everyone can come and be totally safe, and it's called Working Recovery. And at that symposium, we're going to delve into all of this in greater depth.
So tell me about some of the things that we're specifically going to talk about in the symposium, just kind of like an overview of the agenda so folks know what to expect.
So we have engaged some internationally acclaimed scientists, and they are going to dive into some of their studies that demonstrate from a scientific perspective how employment is really actually helpful to one's recovery journey. We'll also talk with experts and providers across multiple disciplines about the fact that in order to have an effective job training program, you have to collaborate across systems. We'll also focus on something that's becoming kind of a national buzzword, and that's how to advance recovery-ready workplaces, because you can train people all you want, but unless you have employers who are willing to hire them, people who are employers who are recovery-ready, we're not going to have that mashup that we need. And we'll also hear from people who have actually gone through our program, the graduates of our program, about what their experiences were and how they think these programs help them. And we'll also be digging really deeper into the conceptual framework of how we designed our ATR program model. A lot of thinking went into it, into the design, and there have been a lot of iterations over the years and quality improvement over the years. So we'll be talking about our current model. So our virtual symposium called Working Recovery is going to be happening online on September 14th. It's totally free, thanks to support from our funder, the Massachusetts Department of Public Health, Bureau of Substance Addiction Services. And all you need to do is register in advance to be able to come. And you can come to one session, you can come to 2 sessions, you can come to the whole day, whatever you can fit into your schedule.
Awesome, thank you. And so folks, I'm gonna actually put the registration link. I'm talking and typing at the same time. I'm gonna put the registration link for Working Recovery into the comments on this live broadcast. And then after we finish today, I'm gonna add it to the video description so you can find it. You're just gonna wanna go ahead and click on that link, fill out the registration, and it'll take you 2 minutes. And you're going to get free live online access to that. And you're also going to get on-demand access for it after the event concludes. And Rebecca, just to confirm, we're also offering continuing education for this, right? We have...
Yes, so we have NADAC CEUs, and we have LADAC, which is specific to Massachusetts. And we also have an application in for social work to NASW, and we're waiting to hear from them, but we're confident we'll get those CEUs as well.
Okay, great. So folks, go ahead and register for that event. If you attend live, you'll be able to get your continuing education certificate that same day. If you watch in the replay, you'll have a couple weeks afterward to grab that as well. And Rebecca, I just checked, we actually have over 1,000 people who are registered for this event already.
That's pretty mind-blowing.
Yeah.
First symposium we've ever done with 1,000 registrants. That's pretty good. It's very exciting.
It is pretty exciting, and they're from like all over the country. So I know that you're really excited to see this expand, nationwide. And I'm hoping that the folks who are watching this live and in the replay will join us as well. So as we move toward wrapping up here, let's just really drive home the impact of a program like this, what's actually possible with something like what you've done in Massachusetts with access to recovery. You shared some of the results from the career building services, but big picture, tell us about what you've accomplished overall in Massachusetts so far.
So we started in 2010. We enrolled our first participant in January of 2011. We started in two cities. Actually, we started in one city in Massachusetts. And since that time, we have enrolled and serviced 30,000 people throughout Massachusetts. We've expanded to 5 cities. Cities are really eager to get ATR into their cities because it's a tremendous resource to them.
So in 10 years, 30,000 people in 5 cities have been able to access this menu of services because of the Massachusetts ATR program.
Yeah, that's right. And actually, the career building services I told you that developed a little bit later. But now we're serving like 700 people a year about, and it's like we're running a small college. We have a registration process. We offer an array of job training programs across the state for ATR participants, and the numbers just keep climbing as the word goes out that they get training in really good occupations and find good paying jobs. And so it's just keeps growing and growing.
This is absolutely amazing. And I just want to personally say thank you for everything that you do to support people in recovery. We've worked together for a long time, and I can very confidently say that you and your team are truly changing lives with the work that you're doing.
Oh, thank you. Thank you. Yeah, I work with a phenomenal team of people and with support from the state. And we believe that the model that we've designed for ATR and especially for the career building services can work anywhere. As long as you have the passion to do it, you can do it. And I'll be happy to share that model with you more at the symposium.
Awesome. Rebecca, thank you so much for joining us today. Thank you for telling us more about the symposium. This was just really fun to hang out with you and talk about this great work that you're doing.
Thanks. Thanks so much. Thanks for having me.
You're welcome. All right, folks, I'm going to let Rebecca go, but while she is signing off, I do want to invite those of you who are watching to go ahead and join Rebecca and the rest of the team at the Working Recovery Virtual Symposium on September 14th. This is going to be an awesome program. That registration link, again, is in the comments. It's also in the video description, and we would absolutely love for you to join us. Folks, I'm Kristen King on behalf of my colleagues at AHP, the entire Access to Recovery team, and my digital strategy and online events team. Thank you so much for joining us. We will see you next time on AHP Live. Have a great rest of your day. Bye now.